Welcome to the Behavioral Observations Podcast, stimulating talk for today's behavior analysts. Now, here's your host, Matt Sikoria.
Doctors Danny, Conine and Jenn Fritz, welcome to the Behavioral Observations Podcast. This is the 22nd Inside JABA podcast series. It's amazing. I know I say that every Inside JABA episode, but to get up to 22 of these, it's been a lot of fun doing this. And this paper we have to discuss is going to be no exception. So again, thanks for joining me today. I really appreciate it.
Thanks for having us.
Danny, you're the first author on the paper that we'll review. Let me pull it up here. It's evaluating a screening to intervention model with caregiver training for response to name among children with autism. So as I was remarking to Jenn before you hopped on, this paper has so many awesome things to review. I hope we get a chance to cover them all. And one of the reasons why both John Barrero and I were excited that this was going to be featured on the series is because it had so many interesting aspects to it. And so we'll get into all that and more. What I'd like to do before we do that, though, is I'd like the audience to get to know you guys a little bit better. So, Danny, if you don't mind starting first, can you tell the audience a little bit about your background and, take us up through what you're doing today?
Yeah, no problem. So, currently, I guess I'll start with today. Right now, I'm on the faculty at Georgia State University here in Atlanta, Georgia. And I actually also direct our ABA programs here at Georgia State, which is great. I love it. Been here for 5 years now. Prior to that, I got my PhD at the University of Florida with Tim Bulmer as my advisor. And that was, I graduated in 2019. And prior to that, I really spent just a lot of time working in the field of behavior analysis. I sometimes call this like a non-traditional route to higher education, but it's actually, I think, not very uncommon either, is that after graduating with my undergraduate degree, I spent about 7 years working in the field professionally as a behavior analyst at the bachelor's level. So I was first just sort of like a behavior tech before registered behavior technician was a thing. And then eventually was a BC ABA and had a couple of clinical roles, a research role, was in homes and clinics and that sort of thing before I eventually did decide to go back to get my PhD. So yeah, I guess that's sort of the story.
Well, that's pretty cool. So you get some definite time in the trenches, some street cred, as one might say, and I'm sure that informs your scholarship and practice today. So that's pretty cool.
It does, yeah, and help me remember too that this study is very directly informed by that too. So
okay, all right. I look forward to hearing about that. We'll plant that little seed for later on. So, Jenn, how about yourself?
Yeah, hi. So I'm a professor at the University of Houston Clear Lake. This is my first year as associate editor for JABA. I also did my work at the University of Florida, so I have very similar background to Dr. Conine.
Go Gators.
Yeah, go Gators. Yeah. That's right. And, I obviously coming from that tradition, when I was asked to serve as a JABA AE, it was very exciting. And, this was my first assignment as that in that role. And, my comfort zone. Yeah, you were very, yeah, I know. It was fun. My comfort zone is in behavior reduction, but this is very clearly not. But I was very delighted when I saw it was Danny's paper. And this is actually the second time we got to work together. I don't know if you remember, but back in 2018, you did the work on the relative preferences for edible and leisure items. Yeah, we got to work together then. So I remembered that. And so I really looked forward to it. Danny's papers are always so well written. And then watching the paper take shape was just a lot of fun. So I'm also going to quote you real quick. I hope you don't mind. But
sure,
in your email,
I'm ready. I'm excited. I know what my quote is going to be.
So it's a lot of fun to hear the influence of our kind of common history with doctors Tim Bulmer and Brian Awada. So you said, the revisions make perfect sense and are straightforward. I expect we can complete them in short order. And that phrase, that short order, I can just hear it in both of their voices.
It's so funny.
So it was just such a pleasure to work with you. Someone so bright and kind also.
Oh, well, thank you. That's really too kind, Jenn. Thanks for all the compliments you just sprinkled in there. It's really, really nice. Thank you.
It is true.
It's a good model of
work with you
dispensing.
two times.
It's a good model of how to dispense reinforcements. I have to also, I guess, observe that the University of Florida is strongly represented amongst the guests of behavioral observations. I always kind of joke that they should sponsor a segment on the podcast, but so many Florida grads on the show over the years. I be interesting to kind of count them up and rank the various programs, but Florida's got to be like way higher than any other program. So, and this is a bit of a tangent, and so listeners, I promise we'll get into the paper here shortly. But when I interviewed Tim Hackenberg, we talked about like the heyday of UF, and I think I've discussed this with others and stuff like that. So it's just got an amazing history, and its contribution to behavior analysis, is way up there with all the other storied institutions that we have. So really just an amazing, again, institution, and has set forth many, many great scientists and practitioners over the years. And so I guess having said that, I want to awkwardly segue, I guess, into the paper. So response to name. So let's start by getting all our listeners on the same, I guess, terminology footing. What do you mean when you say response? I think obviously people have an idea what you're talking about, but specifically, what do you mean by that? And there's an interesting passage or two in the paper about distinguishing this from eye contact. Eye contact is something that comes up a lot, especially these days when we're talking about, populations of individuals who, with ASD and things like that. So can you just walk us through that this repertoire or concept? I don't even know how to categorize it. So just help me out here.
Yeah, absolutely. And I'm so glad that you asked it in those two parts. So I'm going to kind of like take it in two parts, talk about what is response to name, and then talk about what differentiates it from eye contact as well. So just generally speaking, response to name is a developmental milestone, is where it really first shows up in the literature, is as this developmental milestone that tends to occur in the first year of life for typically developing children. So babies somewhere between 6 months and 1 year of age will start to engage in this behavior where a adult or someone in their environment calls their name and they begin to respond in characteristic ways. Typically that is by turning toward and looking at the person who calls their name. And I think this is kind of important as we think about the topography of the response. It emerges in that form because if you think about an infant 6 months to 1 year old, they don't have a lot of other behavioral topographies in their repertoire aside from turning around and looking and that sort of thing. So that's how the behavior typically shows up first. Now, the reason response to name gets a lot of attention in the research literature is because it does have some special significance in terms of autism spectrum disorder and some other developmental disorders and disabilities, in that children who later go on to be diagnosed with autism often miss that milestone. So by the first year of life, this is one of like the CDC's know the signs of autism things, is that if a child is not reliably responding to their name by about 1 year of age, it's a pretty strong indicator that they may have autism and they should be referred for some sort of diagnosis. And that's true with a couple other developmental disorders as well, but especially so with autism. And that is so consistent a finding that you'll see response to name on pretty much all tools that are used to screen for autism or diagnose for autism in early childhood. And, I get Google Scholar alerts all the time about where my papers are being cited and stuff. And there's multiple times a year papers coming out in the diagnostic autism literature about using response to name as this unique marker to diagnose autism earlier and earlier. So that's where it shows up a lot. Now, accordingly, because a missing response to name in early childhood is characteristic of autism, it also shows up in our intervention curricula as something that we often work to improve if it's absent. And I like to think a little bit about why, because I think it's sort of easy to take it on face value that, okay, most typically developing children engage in this behavior, children with autism do not, therefore we should work on it. But I think that's often sort of an unsatisfactory reason to work on a behavior. But you can think about many other reasons why this is important, right? So if a child is not responding to their name in early childhood, it's probably the case that they're missing out on a whole lot of what's going on in the social world around them, right? So missing out on talking with caregivers, talking with peers, learning opportunities in an early childhood classroom environment, that sort of thing. It's also a huge safety risk, as we know. So if a young child, especially now that they're at the age that they're walking around, running around, if the child is running toward the street, that's the first thing a caregiver uses to get them to stop, or children not respond to their name in that way. It's quite an important thing to address. And I also just like to think about it as one of those earliest sort of auditory discrimination skills that we see. Sort of thinking from a verbal behavior perspective, right? One of those earliest signs that we can see that a child is responding differentially to various words that people say in their environment. And so if that cusp, we often talk about the skill as a behavioral cusp, if that cusp is absent, we may be missing a lot of other related auditory discrimination and verbal skills. So
I see. So
that's a broad overview.
Yeah, no, that's really helpful. And I think it gives a lot of context to the discussions that are going on about, should we train eye contact and things like that, or, is orienting in the general direction good enough and things along those lines. So it's a very important topic for both as a cusp, as you say, and certainly this as someone who consults in schools with kids with behavior problems, sometimes kids who have these sorts of challenges, responding to the name and from a safety standpoint is just huge.
And I guess oh, sorry, go ahead, Jen. I was going to say, I want to make sure we get to that second part about the topography as well. But
that's it too, and the social validity of the whole thing. I do have a child, and the social response to their name is so important for the parents too. So that whole relationship with them. I want my kid to listen to me. I understand that deeply. Yeah, but it's very interesting. So go ahead. What were you saying about the topography?
Oh yeah, that was the other part of Matt's initial question, right? Was sort of how do we differentiate this from eye contact, which I think is so important. And for me, this comes down to one of those form versus function issues that we are well equipped to talk about in behavior analysis, right? So response to name refers to like the functional context in which the behavior occurs, whereas eye contact is a behavioral topography. And so response to name simply means that there's some response that you engage in differentially and uniquely when a person says your name. Like I said before, in early childhood, that often looks like eye contact because that's what infants do a lot of, at least typically developing infants. But if we think about how we as adults often respond to our names, there's a lot of different ways that we engage in that behavior, right? The most common one that we think about is a vocal response. So like if I'm at my desk doing work, someone comes to my door and says my name, I may not turn and look at them. I may not turn and look at them in the eyes for sure. I may say something like, oh, hey, what's up? Or give me a second, or, what have you. So that is a differential response to my name, but it's not in that form of eye contact. And children as well do this, right, throughout all stages of life. There's not really a rich literature on how that topography shapes across the lifespan, which I think is a ripe area for future research. But I think anecdotally, we see a lot that kids very young look in response to their name. And then as vocalizations come online, they start to engage in more vocalizations. Maybe looking gets a little less frequent. And that's sort of a natural flow that occurs. And then eye contact itself is a topography of behavior that could have all kinds of functions, right? So we could think about turning and looking someone in the eyes when your name is called, but we also talk about eye contact as sort of like a social conversational skill. Are you maintaining eye contact while having a conversation, or making eye contact while asking something of a person or something like that? And as you sort of alluded to too, Matt, eye contact has special salience for autistic populations in that there's an abundance of evidence and report to suggest that, or to indicate that eye contact can be highly aversive for a large number of autistic people. And so that's why I think as we talk about response to name, it's really important that we don't immediately conflate it with eye contact. We try to be really deliberate in the study about not doing that. If I could indulge in a brief aside, I feel like I'm talking.
Oh yeah, please. No, that's that's what we're here for. Yeah, go right ahead.
Great. So there's the definition that we use in the study relies on this thing that we call the eye region, which is like if you can imagine an imaginary circle that's drawn from like the outside corners of your eye to your nose and your eyebrows. So like you can draw, it's not even a circle, it's like an ellipse, right? That's the definition we've ended up using for 3 studies now. And where that actually came from was when I was in graduate school working on the first study in this line of studies. We all sat around our meeting room during our lab meeting and we said, let's just kind of try this out. And so we would look at one another at various parts of our face and I'd say, do you think I'm looking at you right now? Do you think I'm looking at you now? Do you think I'm looking at you now? And we kind of landed on, if you're in that general zone, it doesn't look any different to you than if I was staring you directly in the eyes. So like, it's kind of good enough. And so that's what we've used for a while. And then in some other studies that we've been working on since, we've even broadened it further to like looking at the face, because I think in general, we often think we have this real good sense of someone's looking us in the eyes, but our informal testing suggests maybe we aren't really so skilled at that as we think. Yeah.
Yeah. I think the term you use is just, I think I don't want to put words in your mouth, so correct me if I don't have this just right, but that, some sort of differential response to hearing your name. And that is just to me, a very pragmatic, common sense way of breaking this down. So I really like how that was described in the paper and as you're doing here. And just for listeners, we will put a link to the paper in the show notes so you can go check it out yourself and see how nicely this was written up. So what do we know about, what does the current literature say about response to name, interventions to improve or bring it about?
Yeah. So to date, and I'm thinking sort of to date at the time that we were writing this paper, the consensus in the literature was sort of, and I guess still is, sort of that some components of really effective interventions are, first of all, identifying really highly effective reinforcers for this behavior. That has proven to be surprisingly, and I shouldn't say surprisingly, it should be unsurprising to us as behavior analysts that reinforcement is the answer to all of our problems, but immensely important is finding the right reinforcers and finding really valuable reinforcers for the child that you're working with. Oftentimes, those do need to be tangible reinforcers. So in the literature to date, trying to use social reinforcers to improve this behavior has worked sometimes, but rather infrequently. And so oftentimes we do need tangible reinforcers and very, very powerful, meaningful ones for that kid. So that's part number 1, really good reinforcers. Part number 2 is prompts if needed. So if the child is not looking at you or doing whatever topography you've selected when you call their name, you need some way to evoke that behavior with a prompt. And then the third is differentially reinforcing prompted versus unprompted responses. If you do, in fact, have to deliver prompts. So reinforcing unprompted response to name at a much greater magnitude of reinforcement than prompted response to name. Those tend to be the strongest features that we've seen in studies to date.
I see it. And all of those require, I'm guessing, very careful assessment and analyses to figure out what to use, when to reinforce, when to withhold, how to fade, and things like that. So I'm sure we'll get into some of the particulars of that as we go forward. But I guess my comment is just an acknowledgement that it requires, I'm guessing, quite a bit of skill and training to be able to pull off some of these interventions. One of the interesting aspects of the paper is that you describe 4 categories of baseline responding, or I guess, categories or classifications of how one might or might not respond to their name being called. So can you walk us through those? I thought that was a really interesting breakdown.
Yeah, absolutely. And this was a big part of what we were after with this study, was sort of testing this idea that we had actually in the study that preceded this one, which was a part of my dissertation work. This idea that perhaps we can look at a child's baseline responding and a baseline assessment of response to name and sort of predict, based on how that looks, what intervention conditions are going to be most effective for this child without sort of doing more intervention than is needed. So can we jump some steps, but also not go too far down the intrusiveness of intervention pipeline if we don't need to? So this whole idea of these 4 types actually emerged at the end of the study that preceded this one. So we didn't actually go into that study with this idea in mind, that study was conducted as also a non-concurrent multiple baseline across participants. And I remember at the end of that study, this is our 2020 paper, sitting down with my advisor, I was in graduate school at the time with Tim Vollmer, and saying, Tim, we've got like all these kids in a non-concurrent multiple baseline, and this graph is insane. Like, I don't even know the most efficient way to present these data. How do we make sense of this? And we worked through this idea kind of. I remember Tim saying to me, well, is there any way you can sort of look at the baselines and meaningfully group them based on how their baselines looked and create some sort of sorted multiple baseline designs in that way according to and it turned out, yeah, we actually did see some meaningful differences. And that's where this whole idea came from, was looking back at all the data we had collected and saw that there actually were some unique patterns that shook out of all the baselines of these kids that we had assessed so far. So it's a long way for me to now tell you what the 4 types are, which is the one that we called type 1 means that these kids mastered response to name, or like showed mastery level response to name according to our criteria in a baseline. And that actually did happen in the previous study and did happen informally in this study as well. That oftentimes we would get kids referred to our study where their clinical team would say something like, hey, this kid needs intervention for response to name. They don't respond to their name very often. Once we sat down with them in a session room and conducted formal baselines, we saw actually these kids were pretty good at it, which I think is an interesting phenomenon in and of itself, that discrepancy between what the clinicians are reporting and a structured assessment revealing actually they do have this skill in the repertoire. And in our baselines, we are intentional about it's not a no consequence baseline like we often think about when we baseline skills. Maybe, we don't provide a consequence for the behavior we're baselining. We're intentional here about providing what we call naturalistic social reinforcers. So we call the kid's name and then make some sort of natural conversation with them. So like, hey, what are you doing? That's a really cool puzzle you're playing with. You're doing such a great job today. Hey, nice to see you. Whatever. We just kind of like make a little conversation. And under those conditions, these type 1 kids engage in mastery level response to name, which is like, wonderful. You don't need intervention on this target behavior. Great news. That's the type 1. Type 2 kids are those who engaged in some response to name, but it was shy of our master criteria, which was 67% of trials or greater. So these are kids that engaged in somewhere between 10 and 67% response to name. And for these kids also, their response to their own name was reliably discriminated from other names. So when we called other names, they weren't really turning to look at us. When we called their name, they were sometimes turning to look at us, but just not often enough. So we call this like low and discriminated response to name. So these kids, we often talk about like skill versus performance deficits. This would be a clear case of not a skill deficit, but a performance deficit, right? These children know which name is their name. They know or seem to know what behavior we're expecting them to engage in. They're just not engaging in it very often. So those are the type 2 kids. Type 3 kids are those who, for one reason or another, engage in undiscriminated responding. So they look at us when we're calling other names, and they also look at us when we're calling their name, and without a reliable discrimination between the two. And then the type 4 participants are actually the ones that we see the most often, which is probably, I would think, an artifact of how we recruit for these studies, because we ask clinicians, hey, send us your kids who need intervention on this behavior. And we see these type 4s the most, which is low or no response to name. So we do an initial baseline and we see almost 0 or absolutely 0 instances of them turning to look at us. And in those cases, we talked about discriminated versus non-discriminated with the type 2 and 3. But with the type 4 situations, it's often like impossible to even talk about discrimination because they're not looking at us for either name. And so that's a case where it often looks like a real skill deficit, that the behavior is just not occurring at all.
That's very helpful. And the idea that you can create a profile, if you will, of a learner who might have some of these challenges and then arrange a treatment that is more efficient based off of that profile is promising for sure. So that's it's one of the reasons I'm glad you walked us through that, and I'm grateful that you include that in the paper.
It was one of the areas the reviewers were super excited about as well. So I know that the readers and the listeners to the podcast will also love that description because it is very interesting.
Absolutely. So this is a 2-study paper, and so we can tackle this however you'd like. But I guess big picture wise, what were you trying to accomplish either with study 1 or study 2 or the program of research more generally? You can, I guess, take that in whatever direction you like.
Sure. Yeah. There were two main purposes of the study, which is where the two sub-studies come into play. So the first purpose was, like I was just talking about, those 4 screening types we came up with at the end of our 2020 study. When we were sorting through our data and going, is there a story to tell here? Is there some more meaning to the data? And what we speculated based on those data was it did look like for the type 4 participants, or even for the type 3 participants, we might be able to skip some of those steps that we knew would be ineffective and have a more efficient course of treatment. And so we sort of hypothesized, well, if we were to do that, we would probably lower the total trials to mastery even further and have a more efficient course of intervention overall. But we hadn't tested that yet, right? So it remained an empirical thing to try out, is say, well, what if we did use those types to sort of screen kids into specific intervention conditions, and would that make things go more smoothly? That was the first thing we really wanted to test, was like put that idea to the test directly. The second thing that I really wanted us to tackle with this study was including caregivers in the process. We had sort of tried informally to do that in the last study, but the data were really messy and didn't make it into the paper. So it's something I've been wanting to do for a very, very long time. And none of the response to name studies, intervention studies, at least in the literature to date, have included caregivers in the process. So that's something we really wanted to do. And the way we set it up in this study was by doing two things. So we conducted baselines with the parents of these children before, during, and after intervention for response to name with a clinician. So we kind of kept the parents in baseline to see, is there going to be any generalization, any generalized improvements in responding with the parent? If not, then we'll conduct training with the caregivers to teach them how to do this intervention themselves at home.
Great. So and there was a really cool section of the paper that described the, I guess, rules or conditions under which you would either pause or terminate the sessions based on, I guess, loosely speaking, observed distress, and those are my words, of the participant. And I just thought this was a really elegant way to get at the concept of assent and willingness to participate. I'd love for you to describe that, because I thought that was such a cool component.
Yeah, for sure. And you're right. This is exactly our participant assent procedures. So when you're conducting a research study, your IRB typically wants to know, what are your consent procedures? So how are participants formally consenting to be a part of the study? And what are your assent procedures if you're using child participants? And that's often because with child participants in a study, they often cannot meaningfully provide informed consent for themselves because they are minors. And in this case, minors also with a developmental disability that includes significant language impairments. So their parents are signing them up to be in the study after reading a full informed consent form and so forth. What's important then is that IRBs rightfully also want to know that the child themselves is willing to participate in the session when it's placed right in front of them. And so the reason we settled on this in the study is, again, as I mentioned, these are kids who are not responding to their names reliably. And so, as you can imagine, they had a host of other associated language deficits, where if I were to sit down and do what is sort of an assent procedure one might do with a typically developing school-age child, which is, I'm going to read you a description of the session procedures that I'm about to conduct and ask you, does that sound okay? Would you like to do that today? These children could not provide really a meaningful yes-no response to that sort of complex question. So this is what we did instead, is we monitored always. And I think really what I'm about to describe, I think, is a formalized way of doing what I think we ought to be doing all the time in practice. And what I think a lot of us, I hope, do all the time in practice, right? Is that while we're working on this target behavior response to name, we're sort of continually monitoring for, as you said, signs of distress, like signs of discomfort, challenging behavior, whining, crying, attempting to leave the area. And if that starts to happen, we just said we would pause the session, right? So we just kind of take a break. We don't need to work on this behavior right now. We can kind of figure out what's going on. And that often meant things like looking for other reinforcers, looking for, what's the occasion for this? Do you need to go to the bathroom? Are you in pain for some reason? Right? Just figure out what's going on with the kid like you normally would do. And then we only resumed session if either those indicators of negative affect ceased or the child sort of came back to us to restart the session, which, as you can imagine, happens a lot because we have a lot of preferred toys in the setup here. So, the kid's going to come back over.
They voted with their feet, as it were.
Yes, exactly. Or both, right? So if one of those things happened, then we restart the session. And if we were unable to do that in a reasonable time frame, then we would terminate the session. Yeah.
Did you have to act on those guidelines during the study? How did that work in practice? Because it sounds awesome the way you just laid it out. I'm just curious what it looked like when the proverbial rubber hits the road.
Yeah, for sure. I would say that first layer of assent troubleshooting that I described, right? Like the kid is engaging in some whining or fidgeting or running away or challenging behavior. That happened quite often. I mean, we don't have a record of how often that occurred because it sort of was a very naturalistic part of what we were doing. But sure, all the time working with young kids, we often had to pause the session, like, let's go regroup and let's come back. As far as fully terminating a session, I can think of one kid where maybe that happened once, but yeah, generally we were usually pretty able to like, okay, we'll give you a minute and we'll find some new reinforcers or we'll rearrange the environment a little bit and you'll come back to work. But yeah, sometimes kid was having a real bad day and we had to say, you know what, we'll stop for the day. That's fine. We'll try again tomorrow.
And obviously part of this intervention, and I'll ask you to kind of walk us through the general protocol here in a minute, but obviously you need to call the kid's name for them to respond to the name. But you have to throw in some other names as well. So there's an interesting process that you described about how you went about choosing some of those S deltas. Can you describe that aspect? I thought that was really neat too.
Yeah, for sure. Yeah, and this is honestly a really deceptively important part of the study, as I see it, is that we do intentionally test for discrimination in the response to name. I don't think this is something that, in my informal observations, that I've seen folks incorporating a lot into their practice with this target behavior. And so if I could just like use the pulpit for a second to
say, yeah, go right ahead.
Please do consider this, because I think in practice, behavior analysts, we're often very familiar with the idea of discrimination training and the importance of alternating between targets when we're working on something like motor imitation or listener instruction following or listener identification of common objects, right? So there's a ton of literature in that area that shows if I just do something like mass trial, touch the ball, right? If I've got an array of 3 objects, say I've got a ball, a cup, and a dog. I don't know what the dog's doing there with the ball and the cup, but a ball, a cup, and a dog. And if I just mass trial, touch ball, touch ball, touch ball, what that literature has shown is that if I just mass trial, touch ball until that's mastered, then I mass trial, touch cup until it's mastered, mass trial, touch dog until it's mastered. The moment that I go and start alternating between ball, cup, and dog, the child has actually very likely learned nothing. Because in those previous conditions, they didn't actually need to listen to the words coming out of my mouth in order to make a correct response. So in that literature, we're very familiar with this idea, but it always strikes folks, I think, as a little novel when we talk about response to name. And so I want to just kind of get the idea out there that it's very much the same concept. If I were to sit down with a child in a room, as we do in this study, they're playing with toys by themselves. I'm sitting next to them. Periodically, I turn and look and call your name. If the only thing I ever said was the child's name, I can't with confidence know that they are not responding to me just because we're sitting together in this room and I turned and I said a word in your general direction, right? So for that reason, those S delta names are super important. Now, when we were first starting this line of research, which was, oh my goodness, 10 years ago, actually, that we started this line of research, we sat around for a while and we thought, well, what should we use as S delta stimuli? Because theoretically, it could be anything. I could say ball, cup, dog, shoe, horse. I could say anything, but that feels a little socially invalid and a little awkward. So we landed, and now not that this doesn't feel awkward also to say other people's random names when you're in a room alone with the child. It does feel awkward, but we landed on this maybe the most reasonable analog to what happens in the real world. That maybe you're in a school setting, the teacher sometimes calls your names and sometimes they call your friend's name, So that's where we landed on this, is we do use other names, and the procedures we use for that, we sort of thought, the first thing we did is we said, let's go to the most popular baby names in the year that the child was born. The Social Security Administration has a list of those because stands to reason that those are most likely their peer names that they're going to encounter in the environment. So we're like, cool, that seems good. Just take the top 9 off that list. Because we need 9 names. We rotate across 3 names every 3 sessions and so on. So we do that. And then also in this study, we started adding in any nominated names by their parents or their clinicians of like peers where they go to school or their clinic or family members or something like that. So some combination of those things form the S Delta names. And I think some combination of those makes a lot of sense for folks to use in practice too, right? I wouldn't get too obsessed over being super systematic about how you choose the names in practice. Now, we had to be because it's a research study, but just be thoughtful about names they're likely to encounter. And also, I should add, we also always make sure to exclude rhyming names or names that sound really similar, right? So if a kid's name is Matt, I wouldn't say Pat, or like Jen, I wouldn't say Ben. You know what I mean? So it feels like we're setting you up to fail there. So
yeah, that's really cool. The in programming the non-targets along with the targets and the training, it kind of reminds me of in ancient history. I did a lot of work in some EAB labs, so just that's kind of reminds me of some old school discrimination training with an animal setting. So
yeah,
good stuff.
And, I was just going to say also there's a question that I sometimes get about those other names is sometimes I've heard folks say something like, well, isn't it normal to respond to somebody else's name in your environment, right? So say I'm in a room. One of my committee members, actually, my dissertation, when this was my dissertation years ago, called this the cocktail party effect, right? So you're at a party in a crowded room and someone across the room says the name of someone you know, and you might turn and look because you're interested in what's going on over there. I mean, it's very, very normal. And to that, I say, absolutely. That's totally a normal thing to do, that sometimes you hear somebody else's name, especially think about, I'm sitting in a room with a kid and there's nobody else in the room. And I'm like, hey, Jen. And they're like, who's Jen? What are you doing? Right. So that's, I think, a very normal reaction. And so the purpose of these is not to say, I want to make sure you never, ever respond to the name of another person. Like, that's not the goal of these. The goal of these is that after some exposure to sessions where if you look at me for a different person's name, I don't attend to you or give you anything. If you look at me when I say your name, I do attend to you and give you lots of good stuff. Is there discrimination learning that occurs? I mean, that's really what it's there for. So,
I did love it. The reviewers commented on it as well. And I loved how you picked the social security. That was genius. But there was a suggestion, why not the family pet's name? I mean, I'm not saying I've ever done this, called my child by my pet's name, but
all the time.
yeah.
That did occur to me too. I'm not going to lie, because I've been called, I can remember growing up being, your parents would be flustered or whatever, and then, go through like the list of siblings and, include the dog in it, so as they're trying to go, scroll to the correct name under duress, usually caused by us kids. But anyway, yeah. So I think we've gotten the stage is set to walk us through what the intervention was for, if you can go into some of the details about the actual protocol itself.
Yeah. So intentionally, the interventions are sort of scaffolded in that they increase in complexity. So I'll kind of talk about them in that way. They build on one another intentionally. So as I mentioned, our baseline is a condition where we actually do differentially reinforce response to name. But the reinforcer in that baseline is that natural social commentary I talked about. So I call the child's name. If they look at me, I say, hey, buddy, how's it going? You're doing a great job today. Whatever. I like your shoes. We have to go. Sometimes you say awkward things and you're like, nice shirt. It has an airplane on it. Whatever. You're just talking to a kid over and over in repeated trial session. And then if they respond with other names, I do not deliver that social commentary. So there is some differential reinforcement built into the baseline. That remains in all of the intervention conditions. So even as I talk about, we add in tangible reinforcement in the intervention, that natural social commentary remains every time that they do respond to the name. We're still making conversation. I'm still sort of engaging with you, talking about the toys you're playing with or whatever. I suppose I should also say that the general setup for these sessions is the kids do have some moderately preferred toys in front of them, and they're playing by themselves in between trials, and we're not attending to them. So we're like busying ourselves with our little clipboard or whatever. So sort of simulating a situation in which you would call a child's name. They're overdoing something by themselves and you're over minding your own business, and then you need their attention for some reason or another. So that's the background in which this occurs. So if that baseline does not lead to mastery level responding, which would be the case for those type 1 kids I talked about before, we then start with intervention 1. At least for the type 2 and type 3 kids, we start with intervention 1, which is very simple. It's just we add in tangible reinforcement to the contingencies for response to name. No prompting at all. Which, again, I think this may go against our instincts as practitioners. I think so often we want to get in there with a response prompt and just like prompt the behavior, it doesn't occur. But we've often found that with these kids who engage in the behavior sometimes, maybe we don't even need to go down that road. I just need to start giving you good stuff when you do actually respond to your name. So we start there first. And those reinforcers, like I said, we do a preference assessment to make sure that those are highly preferred items. It's also important that we make sure those items are more preferred than the distractor toys that they're engaging with, right? Because why would I expect that if you're playing with your favorite toys in the whole world and I have some toys that you don't like as much, of course you're not going to shift your attention away from those toys to access some less good stuff that I have. So we just give those tangible reinforcers for response to name, usually foods or toys of some kind, while still talking to the kid as we give those reinforcers. So intervention 1 is pretty simple. Intervention 2 is when we add in prompts, and those prompts come in the form of an error correction procedure. So in intervention 2, we call the child's name. Just like before, if they respond independently, they get a good amount of access to some of their favorite stuff. If they don't respond independently, then we follow up with a prompt. I'll put a pin in that. We'll come back to what those prompts are. We provide some kind of prompt, and then if they respond to that prompt, they get a reinforcer again, but it is at a lesser magnitude than they get for responding independently. So in this study, we used, I believe it was 90 seconds access to a toy for independent responses and 15 seconds access for prompted responses. And then for foods, it was, see, I'm going to mess up the magnitudes because I have the paper in front of me, but it was, like a whole piece of a preferred food item or like a quarter of a preferred food item or something like that. And again, for those practitioners looking to adapt this, you don't have to be that rigid with it. Just make sure that difference is really meaningful and noticeable by the child. For sure, I'll tell you, a kid absolutely notices the difference between you're getting a minute and a half with your iPad for independent responses versus this time I prompted you and I give it to you for 15 seconds and then I pause it because you're like, wait, what? So, I think that's important that they can start to detect the difference, that it's better if I respond the first time. That's intervention 2. And then in intervention 3, which is like the last step on the train here, is we add in a pre-trial interruption procedure where before calling the child's name, we briefly interrupt whatever toy play they're engaging with. So it might mean like I just kind of put my hands on the book that they're reading or take the book away a little bit or something like that to just kind of interrupt their engagement in whatever they're doing. Then I call their name. And then after that, it's just the same as intervention 2. So I hope you can hear there how we're just adding in little pieces every step of the way.
Yeah, definitely. In that interruption or even in ceasing the low magnitude access to reinforcers for prompted trials, did that ever evoke problem behavior? I can imagine I'm just imagining some of the kids I've worked with over the years that would go over very poorly. But
yeah.
I'm just curious how they might have responded to that in the participants in your study.
That's such a good question, especially the question, did it ever? I am certain that it did. I'm certain kids sometimes did not enjoy that. I'm scrolling through kids in my mind right now to try to
I'm
tell
totally
you
putting you on the spot.
Who exactly it happened with.
All right.
I think less often than one might fear.
Okay.
For sure. Yeah.
Fair enough. Okay. Very good. And so, based on this, I guess, preparation, what did you see in terms of how individuals responded to these, I guess, escalating series of intervention steps? In other words, how'd they do when you ran this?
Yeah. Well, it sort of depended on the baseline type that they were assigned at screening, right? So our type 2 and type 3 kids, now I'm going to have to look at the paper for a second, but I think that 2 out of the 3, pretty confident. Yeah, 2 out of the 3 met mastery criteria just with that intervention 1 where we're just differentially reinforcing responding, didn't even have to get involved with prompts. One of them we did then have to go to the addition of prompts. And then our type 4 kids, they mastered it usually in intervention 2 or intervention 3. But with
I
those
see.
type 4 kids, per our screening model, we skipped over intervention 1. We didn't start there because, again, these kids were almost never responding. So we knew we needed some kind of prompt to get the behavior going.
Got it. And just for listeners' sake, when you go to the paper, a couple of things that are important to check out. There's a really nice flow chart about how this whole thing is laid out. So if you're getting lost in the verbal description, there's a nice visual display of, kind of a series of, I guess, if this then that type of decisions through this flow chart. And so that, at least from my perspective, helped kind of glue things together. And then certainly there's the, looking at, just scrolling through here, figures 2 and 3 that shows the participants' data for study 1 will show their response to that. And I might clip some of these for the show notes as well, but it's worth looking up the paper itself. So, one thing that I guess caught my eye amongst others is that the procedural fidelity seemed to be really good. And again, when I say really good, I have no reference range to point to say what is good and what isn't. But and maybe I'm arguing against my earlier point about the high level of training needed to pull this off. But, so maybe contradicting myself. But I guess, is it presumptuous to say that that given the, I guess, complexity of these discriminations that the implementers need to make, that this is this seems, at least based on what I'm looking at from the procedural fidelity data, that this is pretty doable. Sometimes, and again, I maybe have the practitioner chip on my shoulder where like I don't have a room with a two-way mirror, and I don't have all these research assistants and protocols and resources and things like that. And so sometimes you look at a paper that's either in JABA or other journals, and sometimes you think like this is aspirational, and I might not be able to pull this off. But and I don't know if procedural fidelity is a window into that or not, but I guess where I'm going with this, it just seems to me that it look, given that people were able to implement this with a reasonable degree of consistency, that this, doing interventions like this is feasible in a practice environment. I don't know what your sense of that might be, but I'm curious to hear your thoughts on it.
Yeah. I'm so glad you asked this. And actually, I thought about that earlier when you said this requires a high degree of skill. I almost thought, well, hey, maybe,
hang on.
Maybe not. Yeah.
Well, the design of it, perhaps,
Yes, absolutely. And I'm so glad you framed it that way as well. Because you're right, our procedural fidelity was very high. And the people who were implementing the study, very importantly, and this is actually part that was hugely, hugely important to me in how we designed the study, is that those therapists who were implementing the session whose procedural fidelity we scored, those were behavior technicians and BCBAs who worked with these kids regularly, right? So yes, those folks can in fact implement this with a very high degree of fidelity. And I think it sort of makes sense to me why, that these are procedures we use all the time in practice, right? You're reinforcing correct responding, you're arranging discrete trials, you're delivering prompts if kids don't respond. I think those are like the bread and butter of daily clinical practice, especially in sort of early intervention or skill development settings. So folks are really familiar with that. So I think the procedural fidelity sort of makes sense in that way. I do think it's important what you said, that some of that decision making is not captured by the procedural fidelity score. And that maybe remains an empirical question, right? Because we did train those BTs and those BCBAs to do these procedures, like me and my graduate assistants. We did teach them how to do this and provide some oversight in ongoing fashion. So I guess that remains a question, is right. If we were not involved making those decisions about what intervention comes next based on this screening type and that sort of thing, could folks do that independently? I think so. I have a lot of optimism in what people can do in practice. And I've been there, so I think it's absolutely feasible. But yeah, some of that flowchart decision making may seem a little novel to folks. I think some other features of the intervention that may be a little less familiar in people's skill sets are things like maybe running those S-delta trials, as I mentioned before. When I've worked with people in clinics on implementing this procedure, that's one that often strikes people as like, wait, I'm supposed to do what now? But that's not to say it's outside of anyone's skill set. I think it's just a little like, oh, this is strange and feels a little different. That and sort of arranging. One thing that I often see is a challenge for folks in running this protocol is arranging a period of time where the child can play independently by themselves, because that's the backdrop against which we conduct these sessions. And what I've seen a lot of times going to clinics and working with them on this goal, or even when we've worked with parents on this goal, is that we'll say, hey, is there anything that this kid can do to just kind of hang out and play by themselves for up to a 5-10 minute session while you're busying yourself doing something else? And oftentimes that's the first thing we have to work on before we can get the study started. It's like, oh, maybe not. Let's start to identify then what are some activities they can engage in independently. Because I think oftentimes, especially in like early intervention clinic settings, there's an adult engaging with a child so frequently that often gets overlooked as sort of, can we set up this session where they're doing something by themselves? Oh, this is actually something kids not very used to. And so sometimes we do have to take some time to do that. So I think some of that, some of the like conducting a really good preference assessment and making sure that your reinforcers are more preferred than the distractor toys. I think some of those decision-making aspects, as well as the prompt assessment, which we should talk about as well. I think those features are not captured in the procedural fidelity and do require a little bit more of that decision-making. I'm actually kind of reminded of some of the conversation around functional analysis and like practicality in clinical settings and procedural fidelity. I think it's a very similar question, right? That in lots of FA studies, we see high procedural fidelity for people implementing those functional analysis sessions. But the part that isn't captured by that procedural fidelity score is all that behind the scenes decision making. What conditions should you include in your analysis? What conditions should you run next? What if your data look this way? What's your next decision? So yeah, it's a really good question.
Yeah, well, I'm glad you included those data in the write up there, and it would make fellow Vollmer student and Florida alum Claire St. Peter, who's been on the podcast talking about procedural fidelity and has been championing that for years, very happy, I'm sure. So, all right, I want to get into the prompts as you alluded to, but you bring up this thing called a discrimination index. Where does that fit into this?
Yeah. There's another one that I think may be challenging for people to get their heads around and trying to adapt this to practice.
All right, let's get into it then. Cool.
It feels very mathy. But again, if I can use my position to advocate for something, I want to say don't be intimidated by the mathiness. It's really not as scary as it looks on the printed page, I promise. So where this started was in the study that preceded this one. We found ourselves wanting a more numerical way to quantify whether discrimination was occurring at a reasonable level or not, which I think often we use the eyeball test. You look at the data paths and you go, okay, that's discriminated, or okay, it's not. But we had some borderline cases where we were like, okay, we need to start putting a number to this so we can decide, is that little bit of response to other name a problem, or is this still a reasonable enough discrimination? And at the time we were doing that study, one of my colleagues, Eliana Bizarro, was doing a study on multiple schedules. And as a result of that work, she had found this study by Kevin Luchinsky and Greg Hanley in 2014, where they were looking at multiple schedules, among a bunch of other things. They were doing a lot of really cool stuff in that study. One of the things was a multiple schedule, and they calculated this discrimination index to sort of quantify how discriminated was the child responding. And that was in the context of like, we think of like a red card, green card arrangement for requesting. So we just kind of brought that over and adapted it to this target behavior. And what it is we usually calculate this across like the last 3 sessions of a phase, sort of evaluate have they met mastery criteria. And so across those last 3 sessions, we add up the percentage of response to name across those 3 trials. So if it was like 100, 100, 100, that'd be 300 as the numerator, right? And then the denominator is the sum of the response to name percentages and the sum of the response to other name percentages. So let's say we again had 100% response to name for 3 sessions, and maybe we had 2 sessions where there was 1 out of 3, so 33% response to other names or something. So we'd end up with 300 plus 33 plus 33, so it's 367 or whatever. On the denominator, you get 300 divided by 367, and I can't do that mental math, but it'd be some fraction that is on a scale from 0 to 1. And we set our mastery criteria at 0.8, which, I mean, it's not really what it is, but you can think about it as like about 80% discriminating, right? Really what it means is a 1.0 would mean they are perfectly discriminating. They're only responding to their name and never responding to other names. A 0.5 would mean it's literally 50-50. They're just as likely to respond to their name as to a different name. And anything less than a 0.5 would mean they're actually more likely to respond to different people's names than their own. And so, yeah, we use that, again, to determine whether the intervention goals have been met and that a discriminated response has really been established. And we set that threshold at 0.8 or higher. And also to establish that baseline type characterization that we talked about before.
Yeah, and I can imagine that 0.8 would probably capture some of that cocktail party responding that you might have described. Hey, someone's saying something. I should see what's going on. And so
exactly.
So yeah, super cool. So let's get into the prompts. So what was the strategy for prompts that you alluded to earlier?
Yeah. So again, as we first got started on this line of research, one thing that I was super sensitive to is that I have seen in practice over the years people working on this target behavior. And to prompt the behavior, what I have seen is, unfortunately, folks taking their hands to a child's head and turning it to manually prompt them to face them, which is not great. And I'm not here to just heap shame upon people if that's what they do in their practice, but I am here to say, let's not. Because, for a couple reasons, right? If you're dealing with a small child, first of all, that's not very safe. I'm physically manipulating your head and your neck. That could actually physically harm you. And also, it's just very intrusive and restrictive and not something I would want somebody to do to me. I wouldn't want somebody to put their hands on my head and force me to stare at another person in the face. So I was very adamant early on that that's not going to be a prompt that we will use. The question was then, well, then how can we prompt this behavior to occur? And at the time, there was really not any literature. At the time we were first conducting this study, the study that was the first in the series, there's really nothing on response to name interventions to go on. So we actually went to like the joint attention literature, because in joint attention studies, oftentimes that does involve looking back at a person. So we looked at, well, how are they prompting somebody to look at another person, as well as some like clinical guidebooks for response to name intervention. I know one that we looked at a lot was Mary Barbera's verbal behavior approach. So she had some guidelines for how to prompt that behavior to occur. And so we just pooled all those resources together and said, hey, here's a list of prompts that people have suggested in the literature are reasonable to use to get someone to look at you. Then we said, okay, well, which one do we use? And the answer was, we have no idea which of these is the best. So why don't we find out by just running a quick assessment and seeing which prompts work the best? And the answer very quickly turned out to be, it depends on the child. Yep. As is always the case, right?
Yeah, I remember there was a bunch of studies out of the New England Center in the 90s and aughts, and I just the one thing I can remember from those studies is that the answer kind of was like first, it depends is to your so like.
Yep. And I think sometimes we can take that finding of like, well, it depends as like, oh, well, that's a bummer, we didn't learn anything. But actually, I think in this case, that's a great finding, because it tells us then our job is to assess on an individual basis which prompt is going to work the best and also be no more intrusive than is necessary, which I think is super important. So we arrange them in sort of a hierarchy. The lowest intrusive prompt on our hierarchy is a vocal prompt. So there actually, believe it or not, have been kids in our studies who all they needed was for me to say, Jen, look at me. And they were like, oh, now I get it. So that's the least intrusive prompt that some of our kids needed.
So is that
like
just
a tap on the shoulder.
Repeating the calling their name essentially?
In this case, look at me would be the prompt.
Oh, okay, got it.
So the addition of like a clearer instruction.
Mm-hmm.
Yep. So if I would say call a kid's name, I would say Matt. And if you didn't look, then on my next attempt, I would say Matt, look at me.
Okay.
And the look at me is the added prompt. We also did things like a tap on the shoulder, tracking my fingers from your face to my face. And then also like tracking preferred items, so like tracking a preferred toy that I put in front of your face and I kind of bring it over to me. Also this hand prompt thing where we sort of like take a kid's hand and bring it over toward ourselves. Small children will kind of follow, where's my hand going? But as you can feel, this is starting to get a little more intrusive, right? And then we also test combining those prompts with a brief interruption of what the child is doing. And so mix and match, that comes up to, I think, 10 or 12 prompts that we run through. And to do this assessment, I sit down with the kids in the exact same arrangement that we're doing our response to name sessions, meaning the kids playing by themselves. I'm sitting kind of right next to them. And we don't actually say any names during the prompt assessment sessions. We just deliver the prompts. So I might sit down, if I'm assessing that vocal prompt that we talked about, I would just sit down and across 5 consecutive trials, I would just say, look at me. See if the kid basically knows what that vocal prompt means and is going to look at me. We take data on which of those prompts occasion responding on which percentage of trials, and then the one that occasions the most response to name while being the least intrusive is the one that we use. We also now, we didn't do this initially, but now we've decided that if we ever hit 100% responding on any of those prompts as we work our way up the hierarchy, that's great. We'll stop there. No need to evaluate something more intrusive.
Okay. That's helpful. I appreciate you walking us through that. So you conduct the first study. You have some positive results based off of the various intervention strategies that you've just described, and then in study 2, you've taken this to caregivers. So, at what point did you decide to incorporate this into this paper? Was there some thinking about maybe separating these out into different studies? Because I'm just kind of curious how these two studies kind of, I guess, landed in the same article, I suppose.
Yeah, that's a great question. That's a very inside JABA question into the process.
Woo.
Yeah. Well, I kind of mentioned before that in the study that preceded this one, which is our 2020 paper that's also in JABA, I tried to incorporate caregiver training, but long story short, we just weren't really systematic enough about it, and the data were messy, and so they didn't really make it anywhere. So starting this study, I thought, okay, we need to be very systematic from the get-go about what this looks like so that these data make it, because this is so important to include caregivers into this process. Because if you think about it, who's calling the child's name the most often in their life? It's parents in their environment, especially in early childhood, right? So we're really doing it a service if we're leaving parents out of the process. So from the start of the study, we want to make sure we're incorporating parents. A question that I had going into this was, if we conduct the intervention with a clinician in a clinical setting or a clinician that comes to the home and works with the kid, either way, could we just test for generalization to the caregiver? So maybe I'll talk about this a little bit later as future directions. It's sort of an open question. Should I start by teaching the caregiver what to do? Or should I start by working in a clinic, finding out what works best, and then teaching the caregiver what I have learned works best? As you can imagine, by the way, I just framed those things. I think there's some value to figuring out what works before we get the caregiver into all that trial and error. But in the meanwhile, the question is, will the caregiver start to see improvements in their child's responding while we're doing that work in the clinic? So we set up our baselines to capture that. So we brought in the caregivers periodically, or we went to them periodically, or this was actually a study that happened throughout COVID time. So sometimes we went to them on Zoom periodically and would keep them in a baseline condition. And what it meant to keep the caregivers in a baseline condition is that we didn't teach them any way to work on or respond to this behavior. So in the baseline with the caregivers, we said, hey, I'm going to give you some guidance on how many times to call the child's name, when it's time to call the child's name or a different name. But what you do after that is totally up to you, and I just want to see what you think is best. And so that was our baseline to test for that generalization. Then if that responding did not reach master criteria, we always had a plan to, okay, then we'll teach the caregivers what to do so that they can carry these intervention effects on.
I see. And, again, maybe I'm jumping ahead a little bit, but I'm just looking at, what would this be? This would be figure 5. And just looking at how well the parents did in response to your guidance, they really, the procedural fidelity was just, especially with like Zane's dad and, some of the others is,
he was on board.
Yeah, it was incredible how well these parents did. But again, I'm getting ahead of myself. So why don't, if you can maybe fill in some of those blanks in terms of, what guidance you provided them and things like that.
Yeah. Well, I think that's a great point. Going back to your earlier comment about procedural fidelity and is this a feasible intervention procedure, I think our caregiver training data speak to that as well, that these caregivers were able to perform these interventions with really high fidelity.
I mean, if I may just jump in again, I'm just looking, especially to deliver reinforcement at variable ratio schedules like you've programmed, and to fade them out, on those schedules.
Yeah.
Yeah. I'm just from a practitioner's perspective, I'm, imagining how to pull. I mean, it's just a remarkable outcome just from that alone. So I thought that
now
was
we did
really
give them
cool.
lots of supports with schedule thinning, and I want to note that if listeners go and look up this paper online, I want to point out that there is supplemental information, or we call it supporting information, I think is what it's called. There's supporting information available on the article page on JABA, and in that supporting information, I was intentional to include some of the aids that we gave caregivers for doing schedule thinning. So we actually, there's like 2 different versions of a checklist because we tried various things that worked. Some worked better with different parents. So like checklists to aid them in understanding what schedule thinning was. So we did put a lot of supports around that.
Yeah. Okay. And so how did they manage those schedules? What resources did you provide them? You know, like in terms of determining what, you know, how to calculate, you know, okay, I'm moving from a VR3 to obviously an FR1 is pretty straightforward, but as they moved into more variable reinforcement, just in terms of nuts and bolts, like how did they figure that out, or how did you support them through that?
Yep. It was sort of like a pre-generated checklist. So if you think about, say, we're on a VR6 schedule, so that may range in values from 4 to 8, but it averages out to 6. And so we would have these checklists. Again, they're in the supporting information. One involved like boxes and the other involved checking off numbers because certain parents reported that they like different formats better. But it would be pre-generated. So if the schedule that you're on right now is 4 responses, there's 4 boxes. You put a check, and we said once you check off the final box in a line, that means it's the time you give a reinforcer. Next time it's 8. So you're going to check every time they respond independently. And then once you check off the last box in a row, give the reinforcer.
I see. The copy of the paper I have does not have those materials. So I'll find the appropriate link and make sure that folks can look that up. So that's very helpful.
That's why I like to shout that out. I think sometimes it's hard to find the supporting information. It's not always immediately salient from the article where to find it. But if you do go to the JABA page where the article is posted, it's free to download that supporting information.
Great. What were there any? In terms of the results, were there any results from either studies that caught you off guard, or like, oh, I didn't expect that, or was there anything that, like, you know, that stuck in your mind as memorable in one way or the other?
So many things. And Jenn, feel free to jump in too if there's anything that you thought was particularly interesting or, of course, surprising. You know, I think with study 2, I was less surprised that the caregivers responded well to training. So, I mean, the training we did is we gave them nice written verbal instructions. We did some one-on-one coaching with them. We gave them feedback after every trial. And, you know, I was happy to see that they could do it, but maybe not surprising as good news. What I think was surprising to me was the generalization data. So we often saw generalized improvements in the child response to name. While we were doing the intervention in the clinic, the kids started responding more to their parents in those one-on-one sessions with their parents. But oftentimes, well, there's 2 things that we saw. So sometimes if that generalized responding occurred, it would drop off, which sort of makes sense because the parents were not yet delivering any reinforcers for response to name. So it sort of makes sense that the kid's getting reinforcers for response to name at the clinic, not getting reinforcers for response to name from their parent. They're going to try responding to their parent and realize, oh, this isn't as reinforcing here, and then it might go away, which we saw. Another interesting thing that we saw, though, was some kids, that generalized responding maintained throughout our baseline phase at 100% many times. These kids were still responding to their parents at home, even though their parents had not started introducing tangible reinforcers, which I did not think would happen. I thought we would always see that extinction effect for everyone. And so when we saw that, I was like, wow, this is amazing. This is great. We can skip schedule thinning. We can skip ending on a VR6. Like, this is awesome. And so, but what we did with these parents is based on what we learned in some of our previous studies, is that in at least in the short term, we often tried to say, after we got to our terminal VR6 schedule, we tried to say, okay, let's give no tangible reinforcers at all. Let's see if the behavior will maintain just with natural social commentary. And what we found in our previous studies is it always eventually underwent a little extinction effect, at least in the short term. Now, we've had some long-term follow-ups. So there's one kid who was in our first study. She was also in our second study. By the time she got to the second study, she did maintain response to name with no social reinforcers, which I think is a cool It's a cool Easter egg. If you look across those two studies, Bethany is in both of those studies and she responds in that way. I'm digressing. The whole point is that because we know from our previous work that if we were to leave the parents and say, okay, well, you don't need to ever give a tangible reinforcer. It looks great in this baseline. See you later, or see you never, I guess. We know that's not really going to serve them well. So we said, okay, well, let's at least equip them with variable ratio reinforcement. Let's give you like a VR6. Hey, just once in a while when you call your kid's name, just think about giving them something they like, right? Seems pretty feasible. But what we saw is with those kids, and I think it was Zane and Cody, we said, all right, let's start teaching the parents to do a VR6. But what actually happened is that resulted in an extinction curve. The responding started to drop off for the parents under a VR6. And we actually had to go back with the parents to an FR1 and sort of work our way back out to a VR6. So that was surprising, I think, for us, is that the generalization effects did not allow us to jump to non-reinforcement or jump to variable reinforcement with the caregivers. That in every case, we did have to start them at an FR1 and kind of work their way out.
Right. I can see that now. For those playing along at home, that's figure 5. That's that excuse me. That's a interesting observation for sure. So I guess as we've just been going through this, these two studies in a very granular way. So as we kind of come to a conclusion here, let's start to zoom out a little bit. I think there's been already a lot of great information about general practices for building this repertoire, but if there are other implications in terms of how practitioners might conceptualize these types of interventions and try them out on their own, I'm really interested to hear that. We've got a lot of students that listen to the show, so I always like to talk about, in these, particularly with these very research heavy type of programs, what are some potential experimental questions that we still need to explore regarding this particular topic, and any other general implications that you might have. So let's broaden things out a little bit, I suppose.
Yeah, for sure. The problem is I could talk about these studies all day. So
I'm glad, because it's super interesting. So I'm all in. So yeah.
Yeah. Well, let me start with, I think, what are some more practical implications, and then let's segue over to future research directions, which there are a million. So, so I think some of the most important clinical implications that I take away from this study, let's start with the caregiver training piece, what we were just talking about. For me, this speaks to the importance of including caregivers in your intervention process and including them early. So what we did in this study is we didn't get the caregivers on board with intervention until later in the process. We waited until the goal was mastered, and then we started training them. That was for experimental purposes because we wanted to see what would happen. But I think what our data show you is that's not actually a great thing to do clinically, because we saw if there were generalized improvements, they fell apart because we hadn't taught the caregivers what to do. And so I think what those data really mean is get caregivers on board with the intervention plan, teach them to just deliver reinforcement for response to name at an FR1 schedule. That's a very easy thing to ask a caregiver to do, right? Hey, have you ever noticed that your kid responds when you call their name? Give them something they really like. Otherwise, do what you've normally been doing. I think if we were to give that sort of response to these caregivers and then test for generalization, I bet we would see some really, really good results. So that, I think, is a big implication. Get caregivers involved early, give them a very simple sort of intervention like, hey, just give reinforcers. And I think that can go a super long way. I think some of the implications from study 1 come down to, I think, really the importance of giving high quality reinforcement. So listeners will note if they look up the paper that there's one kid in the study for whom we had a rougher go of intervention. Olivia is the one who it took her a lot longer to master the skill than everyone else. The solution for her ended up being sort of refining our differential reinforcement procedures. Specifically, we stopped giving reinforcement for prompted responses and gave more reinforcement for independent responding. And this has been the case across this line of research so far. And if you'll forgive me another time travel moment, with the very first study that we conducted in this line, we had 4 kids in that study. 2 of them had a pretty efficient course of intervention, and the other 2 had a real long, bumpy ride. And it was almost embarrassing to me at the time that with these kids also, what ended up being the solution, we tried so many things. We tried all kinds of like prompt hierarchies and prompt fading strategies and different prompt fading strategies and all kinds of really creative stuff. The solution ended up being, let's do a different preference assessment and get a real broader picture of what reinforcers these kids really like. And let's use their absolute favorite things. And that was it. And so, I think that failure early on had been really instructive for what works now going forward. And so I would say that is one of the biggest takeaways in this line of research. When I see practitioners working on this goal, or when I consult with people that I know, like, hey, we're working on response to name, we're having some difficulty. I want to say 9 times out of 10, the solution often comes down to, okay, well, what reinforcers are we using? Okay, is there something they like more? Why don't we try that? And then that just sort of unlocks everything. So I think with response to name, so much of it is really about building a reinforcing relationship between you and the child. Is that often I think our young children with autism are not responding to their name sort of as a sign that there's a deficit in the reinforcing social relationship that is occurring between the adult and the child. So again, another anecdote, early on in one of our first studies on this line of research, there was a kid, his pseudonym is Avi in that paper, who I distinctly remember in our initial baseline. I sat down for my first baseline session with this kid, called his name. The first time I called his name, he flopped on the floor and started crying, which tells me that his name was historically associated with bad things. Someone's coming over to give me instruction, someone's making me do stuff, someone's making me put stuff away, right? And the real solution to that is we have to flip those contingencies on their head. We have to associate your name with only good stuff is coming, and actually your favorite stuff is coming. And so if I can just encourage folks who are working this target behavior to really think of this behavior from that perspective, how maximally reinforcing can I make responding to your name? And that's going to build a positive relationship. I often hear people too have a little bit of reservation with that, right? Like, we don't want to overly rely on tangible reinforcers. One should not respond to their name for tangible reinforcers for their whole life, which is true. But also, I want to encourage folks that in these studies, we're always able to thin that reinforcement schedule out to a pretty lean variable ratio schedule, which, again, that's something that also disappointed me, I think, early on in this line of studies. I thought for sure we'd be able to get the tangible reinforcers out altogether and see maintenance with zero tangible reinforcers. And this is, again, another bit of Tim Vollmer wisdom. He's come up 3 times now on this podcast. I remember he told me, I was like, Tim, I'm just bummed out that we're ending on a VR10. That's what we used at the time, a VR10 schedule. And I just can't get it out fully. And I remember him saying to me well, is that so bad? It's like, what do you mean? He said, well, I'm thinking about all the times that I respond to my name. When I'm sitting in my office, one of you comes down the hall and says, hey, Tim. Most of the time you're asking me a question or you're just coming to chat or something. And those are good reinforcers for me. But also maybe it's on a VR10 schedule. Maybe you come and give me that paper that you've been needing to turn into me. And that's a tangible reinforcer. Or maybe you say, hey, you want to go grab a coffee? And that's a tangible reinforcer. Or maybe you bring me a coffee, so that I think in our life, we probably respond to our name on some kind of a variable ratio tangible schedule. Is it VR6 or VR10 or is it VR50? I have no idea. But so that's what I sort of like to put out.
I like that. Yeah.
If folks are feeling a little uncomfortable with the idea of tangible reinforcers for response to name, I think it's more realistic than we might first think.
Yeah, just maybe not quite as overt as, and certainly more varied, probably. So awesome. So I know from our conversation before we hit the record button that you're continuing this line of research. So what have you been doing since this paper was submitted, and what's next in terms of this line of research?
Yeah. So one thing that we have been doing, so this is, if you read the paper, you'll see that I say this is something people should do next. And a little, again, inside the editorial process pro tip is, I think a lot of us as researchers, we often say something someone should do next. And you're like, this is actually what I'm literally about to do tomorrow. So this is something that we actually already have done. And we're working on writing up this paper. So sneak preview is, instead of training caregivers to implement this intervention like we did after a clinician delivered intervention, why don't we just start with caregivers who maybe their kids are not in clinical services? Maybe these are kids with newly diagnosed children. They're at home. Parents aren't really sure what to do to work on skill development with their kids. could we work on response to name as one of those early intervention goals and just teach parents how to do it as the first line of intervention? So that's something we've been working on. We've also been looking at whether that behavior has any relation to other skills. So specifically, we've looked at it in relation to joint attention, whether establishing response to name skills also establishes joint attention skills. And if not, teaching caregivers to work on both. So that I think is a really promising thing. I'm really passionate about caregiver training because I think there's a whole lot to be said about these sort of very simple early social communication skills as something that we can get caregivers working on with their kids really early after diagnosis. I think it's well within reach, and it sort of uses our BCBA resources more efficiently, right? If I'm seeing 10 families and working with them all on how to work on some skills to get their child's social communication skills going, then I may have a broader reach than if those 10 kids are coming into my clinic in a sort of way of speaking. So that's something we've definitely been working on, and I think there's a lot more to do there. I think I would also like to see a lot more work, and I say this again, I would like to see this done. So I know I said that was a spoiler alert, I'm already doing this, but I tell people every time I talk about this line of research, please come in, the water's fine. I sometimes feel very like alone doing research on this target behavior, and I am dying for more people to get involved and help out. So please, if this sounds interesting to anyone, please start working on some of this stuff. And I'm happy to help if you would like, or, not if you would not like. But topography analyses, I think we could look at what are the differential effects of if we were to say reinforce response to name in a different topography. Like what if we were to reinforce vocal responses? What's that look like? How does that pan out in terms of are kids really listening if they give a vocal response or not? Or Jenn, you got something to add there?
Oh, I was just going to say, I was going to ask you about that because it is just, there are so many different ways that we respond naturally when somebody calls our name. And you mentioned them earlier, like, oh, hold on a second, or, yeah, or looking, vocal versus actual eye contact, all those things. So are you incorporating those into your future work?
We haven't yet, but it's right here on my whiteboard in my future ideas corner of my whiteboard.
I love those whiteboards.
Yeah, I think there's so much to be done. And again, I would love if anybody else beat me to it, because there's only so many hours in the day. I think there's so many questions there. There's a nice line of research by Lauren Beaulieu is one who does a lot of this, and I think Greg Hanley is on a couple of these where it's in the preschool life skills curriculum where they've looked at whether various topographies of response to name are associated with various degrees of instruction following among typically developing preschool students. So I think we could easily look at some extensions of that to autistic children as well. So I think that would be a great direction to go in. I've also thought about whether we can. Nope, it's gone. What was I going to say? I don't know.
That's all right. There's a lot of there's a lot of ideas. There's enough good stuff here, I think, for to go on for people who are interested in pursuing this for sure. So
to be done. So
yeah, certainly for sure. All right, really good stuff. Congratulations on just a really important paper that hits so many important aspects of practice. It was really, as I was going through it, it was like, wow, check. It's like, wow, this has so many good things in it. So it was really a pleasure to review for this podcast. So I guess what I want to do is if you guys have any concluding thoughts about this, if there's aspects about this that we haven't already mentioned that you want to make sure that you leave the audience with, I want to give you the opportunity to do that. And if not, feel free to take us out with some advice for either the newly minted BCBA or, certainly, a lot of this advice is great for BCBAs of just about any experience level. So let's close with that.
Jenn, anything you'd like to start with? Or?
Start with the general for the newly minted BCBA. I talk to my students about these things all the time. And, I think that your discussion today was really great in terms of like great tight experimental control and the issues that you need to think about when setting things up. And they're always like deer in headlights sometimes when you start getting into the details. They're like, oh, it's very hard. And I tell them, being a BCBA is a very challenging role. Including during graduate school, you're learning the technical terminology. At the same time, you're learning to talk in plain language to caregivers. It's very complicated. But I also tell them to remember, what's hard for you now is not going to be hard for you forever. You're going to gain some fluency, and then you'll know that that is the time to take on a new challenge and keep growing in the field and keep growing as a professional and advocate for excellence in practice. So keep at it. Even if you get lost in the details, it's okay. It will come with time and practice. So you got this.
Absolutely. And I think the journey that this study has gone through actually is for me is quite resonates with that quite well. I think of it, and I encourage readers, if they look at this study and think, like Jenn was saying, like there's so much tight experimental control and there's so many variables happening and so many things are accounted for. This line of research did not start that way. So I encourage people, if they look at this and they're like, wow, there's so much really accounted for, please read the first study in this line that we started. And I want you to see that it was not this tightly controlled for. And I really, like I kind of mentioned before, I think the failures that we encountered with that line of research were so instructive in terms of what we're doing now. So the failures are instructive. There's that B.F. Skinner quote, right? That a failure is not a mistake or whatever. And it's true. So I think, to thinking about, Jenn, what you were saying, that I think folks could get afraid to start in research or afraid to start on an intervention clinically even because like, oh, I'm not sure if I've accounted for everything. And like, sometimes as long as you're deliberate about taking data on what you're doing, keeping a record of what you tried and when, if it's not working, that can inform you in terms of what to do next. And throughout your career, those failures are going to be instructive and build a much stronger repertoire. Like if I had not banged my head against the wall trying things that were so ineffective with those 2 kids in our first study, I would not say with such confidence now that, oh, a thorough reinforcer assessment is going to save you a lot of time. You know how I know that? Because I wasted a lot of time not doing a thorough reinforcer assessment in that study, or a preference assessment, excuse me. But, you get the idea. Yeah.
I agree.
All right. Well, those are some inspirational messages to leave on. So I really want to thank you guys for taking time. This will come out sometime in the future. We're recording this like late on a Friday afternoon. So again, I'm really happy you guys took the time out of your afternoons to do this. And again, congrats on the paper. And yeah, it was really, really fun to read. And you're a great storyteller, about this work as well. So that doesn't hurt either. So thanks, guys. I really appreciate it.
Congratulations, Danny.
Thanks.
Great work, everybody. Thank you, Matt.
Thank you for listening to the Behavioral Observations podcast with Matt Sicoria. You can find Matt's notes on this episode at www.behavioralobservations.com. We also invite you to stay connected with us on Facebook at facebook.com/behavioral observations and on Twitter at Behavior Podcast.